Welcome to Health Affairs This Week. I'm Leslie Erdelack.
I'm Rob Lott.
And I'm Chris Fleming.
The holidays are here. We're recording a special episode today, and we'll get to the details in a minute. But we're mixing things up. I'm here with you guys. So tell me, how's it going? How do you guys feel heading into the last stretch of 2020?
Oh, it's crazy. 2020, no one could have predicted where we'd be today a few months ago. And so I guess I have mixed feelings. It's still a kind of pretty dark time, both literally at the beginning of winter and figuratively with everything that's going on out there, but feeling hopeful and looking forward to 21.
Yeah, and I've sort of hit a little bit of a personal milestone in that my daughter this year is having her somewhat weird, as everybody's is, senior year of high school, and has just started hearing back from colleges and has gotten into 3 now. And so the happy
Congratulations.
Thank you. And my happy news is my daughter's going to college, and then it hits me, and the sad news is my daughter's going to college. Um, But it's a new phase, and very happy for her. How about you, Leslie?
Yeah, so I've been reflecting a lot on a year, like Rob said, that turned out to be unlike, anything I think any of us could have imagined. And it's really given me some perspective. And I think, like a lot of us, I'm really thankful for the small things. And I said that to somebody the other day, and I realized like, oh wow, that sounds really kind of lofty when you put it that way. But small things like I'm in my 30s. I just learned how to use the automatic brew function on my coffee machine. I just got a library card for the first time in my adult life. So I'm all about it. Good coffee, good books. That's how I've made my way through 2020. But as much as I'm looking forward to kind of like this new year, new beginnings, I think the pandemic has really just sort of taught us to be kinder to ourselves. And I really want to intentionally carry that, mindset into 2021. But what a year, right? I think most people would say that COVID-19 has been the defining issue of 2020, and it's been hard to look away. And while all of our attention has been on the pandemic, there have been plenty of things happening in healthcare and in health policy that you might have missed, or maybe that didn't get the attention they should have this year. And so for this episode, we asked the editors at Health Affairs what they thought were some of the biggest developments and stories in health policy this year that had to compete with COVID-19. And today on the show, we'll tell you what they said and why these stories matter. So from the top, Chris, I'm going to go back to March 2020 because we all sort of inconspicuously marked the 10th anniversary of the Affordable Care Act. And like many things this year, the celebration looked very different, but I think it's worth appreciating just what has been made possible through this huge piece of health reform legislation. We know millions more people have coverage. Insurers can't discriminate against people with pre-existing conditions. There are new payment models. Medicaid expansion provides coverage for people with substance use disorders. I'm literally going through the table of contents in our March issue of Health Affairs, which was dedicated to the ACA at 10. But we had some challenges around the release, Chris, given that it coincided with the early days of the pandemic.
Yeah, we did indeed. Actually, we had to actually cancel we had a big release event planned, and we had to cancel it. It was before people figured out how to do all sorts of things virtually as we do now. It's ironic, actually, that the event did not survive because the ACA itself has been, I think, marked by and distinguished by survival. The law really survived Republican attempts to repeal and replace it. Even after President Trump won in 2016, and with Republicans controlling both houses of Congress, people were writing the law's obituary. The law survived the death of 1,000 cuts during the Trump administration. That included, just to give one example, regulations that did things like expand access to non-ACA compliant plans, notably short-term limited duration plans.
And that's not all, though, right, Chris? The administration shortened the open enrollment period, right, and made drastic cuts to the marketing budget and outreach for marketplaces. They really gave it their best shot, huh?
Yep, they did indeed, and then of course the ACA survived the zeroing out of the individual mandate penalty by Congress. Then, barring any huge surprises after the oral arguments in Texas v. California in front of the Supreme Court, it looks like the ACA will survive its latest brush with judicial death. I mean, there'll be, as there always has been, lots of litigation over various parts of the law, but those cases shouldn't present the same sort of existential threat as the Texas case did and a couple of other cases before it.
So the ACA is surviving, Chris, like you said, but how's it doing?
Well, actually, I said it was surviving, and I think it's more than that. I think, particularly given the circumstances, you might even say it's thriving. I mean, the popularity of the law went up when it really became under threat. The enrollment in the marketplaces, in addition, there's also the Medicaid expansion, but the marketplace enrollment stayed remarkably steady. And now, in fact, we've just heard after the close of open enrollment for 2021 that for the first time, enrollment under the Trump administration, enrollment in healthcare.gov, which is the federally facilitated marketplace, actually went up once you take into account the fact that a couple states, Pennsylvania, New Jersey, transitioned from using healthcare.gov last year to using their own state-based marketplaces for 2021.
So I think it's also important to recognize the role that the ACA had, maybe underappreciated role in the COVID response, right? Especially for people maybe who lost jobs or job-based coverage. The ACA was a part of the safety net for a lot of people who had to sort of face the worst of this pandemic.
Yeah, it was indeed. I mean, as you know, obviously, unfortunately, many millions of Americans lost their jobs and job-based coverage, as you point out, and having a safety net prevented the specter of people, perhaps without coverage, having a bad incentive to forego treatment or testing for COVID, which could have increased the spread of the disease. Then there, of course, as Leslie mentioned, you have the mandate for coverage of pre-existing conditions, which prevented a lot of Americans who had COVID from becoming uninsurable, not being able to get coverage for after effects of the disease. And you had other things like, for instance, Congress's provision mandate for the coverage of vaccines by private insurance plans was built on the structure of the ACA's preventive services coverage mandate. So the ACA, you're right, was crucial in mounting our response, however flawed, to COVID-19.
And what do you think happens now?
Well, it's interesting. I mean, Joe Biden, who's, of course, the president-elect, campaigned against the left's version of repeal and replace. People like Bernie Sanders, Elizabeth Warren were pushing to repeal the ACA and replace it with a Medicare for all single-payer approach.
And instead, Biden campaigned really not just on maintaining, but building on the ACA, right?
Yep, that's right, Rob. I mean, some of his proposals, such as adding a public option, increasing the amount of subsidies, the income range where people can get those subsidies, those would require legislation on Capitol Hill. That could be a heavy lift if Republicans maintain control of the Senate, and even if they don't.
Right, because these days, I think pretty much everything outside the budget reconciliation process needs 60 votes in the Senate.
Yep. Though it's also worth noting that the Biden administration will be able to do a significant amount on their own. To cite a few examples, they can initiate rulemaking and roll back many of the Trump administration changes. They could reimpose, for instance, tougher restrictions on short-term plans. They could issue regulatory guidance on topics like Section 1332 waivers.
Yeah, so it'll be good to kind of keep our eyes on what happens. And I think more than anything, the events of this past year mean that there are just many more things to study and to learn from. And you can always find continuing coverage about the ACA and other late breaking issues on the Health Affairs blog. I want to stick kind of with the business of healthcare and go to you, Rob, for another story our editors said was really key this year.
Yeah, one of the issues that came up repeatedly was the sort of role of antitrust enforcement um, in the healthcare sector, and I think it's worth noting up front that mergers and acquisitions, federal enforcement on this front move on a much slower timeline than something like a world viral outbreak, and I think that's a good thing because it meant that there were cases and proposals working their way through the system before the pandemic struck. There are new cases that are just kind of starting off that will have plenty of time to work through and won't be resolved for some time, hopefully after the worst is over. And so in some way, this is the kind of traffic around antitrust has kind of been chugging along despite the pandemic. And one thing we did see when the pandemic struck was the FTC came out and said it was not going to dial back its enforcement actions during COVID-19. And they essentially said, we're going to be watching you. No funny stuff.
That sounds really ominous. But what were they watching out for?
Well, in particular, they didn't want to see large entities taking advantage of smaller, perhaps more vulnerable organizations, taking advantage of them to consolidate their position. We're talking about rural and underserved hospitals and systems that might be in a weak state during the pandemic.
Yeah, I mean, I can remember when the pandemic first started, and people were avoiding going to get treatment. That people were saying, this could be the end of the healthcare sector as we know it.
Yeah, and I guess the jury's still out on that. Things are, really turned upside down, and systems I think are still trying to figure out, the way forward. In terms of antitrust, I think some of the cases that went through that there were some cases that went through that critics didn't really love, and there are some cases that the FTC did push back on, and so it was a bit of a mixed bag.
Well, a lot of other things then spiraled out of control during the pandemic. It sounds like that the agencies tried to stand their ground on some pretty serious potential consolidation.
Yeah, I think at the very least they shined a light on the fact that there are a lot of smaller organizations, even before the pandemic, that were vulnerable to consolidation, and now they may be, teetering on the edge of viability. And it's at least sort of shown a light and begun to build some consensus that unless we invest in supporting those vulnerable organizations, perhaps even with some of the recovery funds, that they could be gobbled up, and that could lead to less competition and higher prices.
So, what do we need to be looking for in the year ahead when it comes to antitrust issues in healthcare?
Yeah, a few things. One, I think it's going to be really interesting to see the potential influence of Vice President-elect Kamala Harris and the administration's new nominee for HHS Secretary, Javier Becerra. As you know, before she was elected senator, Harris was the Attorney General of California. And when Harris became senator, Becerra replaced her as the AG in the state.
And they both took a pretty strong stance on antitrust issues.
Yeah. For example, there was this huge settlement that they won against Sutter Health for anti-competitive practices in California. It was kind of a landmark case in this space, a sort of line in the sand for other systems that may have been trying similar tactics. And it was something of a tag team effort. Harris kind of laid the foundation, and then Becerra sealed the deal when he took office. But I also want to mention two other things quickly on this front. And one to keep a lookout for is mergers that are more complex than the sort of traditional horizontal integration where two parallel systems kind of come together. And I'm talking about complicated unions like the CVS Aetna merger, or kind of under the radar efforts where hospitals acquire physician practices one at a time until their position in the market is really tremendous, and then it's hard to unwind.
Right, and I think these are, trends that after the ACA really surged, right? Because life can never be simple.
Yeah, it's interesting. That's exactly right, and they continue to express themselves in new ways. I think about the famous illustration from the 1900s of the Standard Oil monopoly as an octopus, and it feels that way today. I think there are so many tentacles reaching in so many different directions, and it's hard to keep track of them and hard to keep them in check.
So many tentacles. It sounds like a good description of 2020.
Yeah, I'd be remiss also if I didn't mention the big Facebook and Google cases. It's not health care directly, but it is a huge deal, and they represent completely new territory for everyone in this space. And how these cases play out, I think, are going to be a signal for how strong this administration and the states are going to be acting on antitrust these days. And it's certainly going to influence how the health sector goes forward in its own fraught, competitive landscape.
Yeah, I couldn't agree more. But I want to move on to the last topic that we're going to cover today, and it's one that I do think has been sort of marginalized in the wake of the pandemic, and that is environmental rollbacks. And this story about how the outgoing Trump administration has been sort of quietly maneuvering to expedite and strip down environmental protections.
They've targeted infrastructure and energy projects especially, right? Saying that they want to accelerate these types of projects in order to boost the economy.
Exactly. And the president issued several executive orders to try to speed up and circumvent environmental reviews, allowing what they said, what they called infrastructure investments and other activities to bypass parts of this law known as the National Environmental Policy Act. Again, the stated purpose was to really facilitate um, America's economic recovery. And this is a law that requires, I should say, the government to think about how building a highway, for example, affects the environment and local communities.
Yeah, and when you start to scale those kind of requirements back, it sounds like that's got to have some long-term implications. And as we know, the American policy apparatus doesn't always do long-term very well.
But I think for me, these rollbacks have really led to breaks in the decision-making process, and it's made it a lot less transparent. And because of COVID-19, it's harder for people who are directly impacted by these projects to participate in that process. And it leaves some communities a lot more vulnerable. It leaves them without a voice in terms of saying how these projects could affect their health and well-being, often in places where you already have a long history of environmental degradation. And so the implications from a health equity standpoint, I think, are really pretty significant. And with that, I want to invite you to tune in next week. We have part 2. There's another fun year-end episode coming out with Jess and Babe, where we will pick up where we left off and get into more health policy stories that you might have missed in 2020. So until next week, Rob, Chris, thanks for joining me.
Thanks,
Very much.
guys.
We wish everyone a healthy and happy holiday season. If you need a last minute gift, share this episode with a friend, and don't forget to subscribe to the show wherever you get your podcasts. See you next week.